Thank you for joining us today. If you are joining us to learn all about the bladder and the vaginal symptoms that can happen in perimenopause and menopause. So Dr. Rachael, Chrystal and I are working together at Rowena Health, and we are really enjoying seeing lots of patients, and lots of patients suffer with this. Maybe about 80% of us will suffer from this syndrome as we get older. So we are together going to talk about all the different things that we can help you with. So looking at the different e-strings and the different products, and we have a little diagram. So I'm just waiting for Rachael to join me, and then we'll go into everything that you need to know and talk about the different sorts of ways that you can treat this using non-hormonal treatments and hormonal treatments. So we have our Two Doctors Chat Menopause videos all loaded onto our YouTube. So you can go back and look at the ones that we previously have. And they cover things like premenstrual syndrome, migraine. Oh, Rachel's just joined. I'm just going to, wonderful. Green in just a minute, I hope. So the other things that we've got are what happens to your periods. So you can access them all through our... Oh, hi, Rachael.
Hi, Carys, you okay?
Really good. How are you?
I'm really well, thanks. How are you?
Really good, thank you. How's your week been?
My week has been good. Yes, I've had a good week. I'm really looking forward to this weekend. My mum and dad are coming, and we're going to go and see Chicago, the musical. So I'm very much looking forward to that.
That sounds fantastic. Yes, yeah.
What about you? How's your week been?
It's been good, actually. It's been quite quiet. I've been doing lots of writing. I want to try and get the chapter almost finished. So I've been looking into the ovary in great detail this week, which has been exciting for me, but maybe not for everyone. But actually, it has very interestingly looking simply just at the anatomy of the female body, which has been really, really good. So that brings us very nicely into today. I was just saying about our Two Doctors Chat Menopause videos that we've got, which are uploaded onto our YouTube channel. So it makes it a lot easier to find things, and that we're going to talk today about the bladder and the vaginal symptoms, and that everything that we say in this is discussion between us both, but can't be used for individual medical advice. So please do go and see your doctor if you are finding that you're suffering with these symptoms and you want to talk about things in more detail. So I'll have a look. Okay, so somebody's just asking a question there. Yeah, we'll see if we can cover that, certainly. Let's talk about the bladder symptoms and the vaginal symptoms, and what are they? What symptoms might we experience when we start? Should we talk about the bladder first?
So really common, and I suppose there's a few different symptoms that women might experience. Often we might see people needing to go to pass urine, go for a wee more often. Often they might find that they've got something that we call urgency, so they're needing to rush to the toilet, perhaps a little bit more than they used to. Some people might start to have some incontinence, so particularly stress incontinence, which is where you might have a little bit of leakage when you're coughing, sneezing, exercising. And of course, this can obviously have a significant impact on quality of life, and ability to do the things that people normally do. And, for example, I've had some patients, I'm sure you have, who've stopped exercising, stopped doing the things that they normally enjoy because of their symptoms. Some women will end up getting up overnight more, won't they, to go for a wee, pass urine, which then obviously impacts on sleep as well, doesn't it?
Yeah.
And then that can all have a real sort of knock-on effect, can't it? Because then you start worrying about, if you're out and about, being able to find a toilet, and then some people start restricting their fluid intake, because of that, which just makes some of the symptoms worse a lot of the time.
Mm.
Um, and some women as well will end up with more urinary tract infections. So I don't know about you, Carys, but certainly I see that in a lot of older women who perhaps have been without estrogen in their body for a long time, and we're often seeing them, aren't we, as GPs, frequent symptoms of urinary tract infections, and often that's exacerbated by the low levels of estrogen.
Yeah.
So quite a range of symptoms. And do you want to sort of explain a little bit about, why this happens and what's going
Yeah.
on?
So another thing as well is that the latch key leaking, isn't it? Where you
Mm,
put your key in the door and then the only thing you can do is run into the house and quickly find the nearest toilet. And that's actually the leaking on the way to the loo. So there are different types of incontinence, aren't there? There's stress incontinence where I describe it, you're putting stress on the body. So you're coughing or sneezing and you might have a little leak. And there's urge incontinence where you're suddenly out of nowhere, you suddenly need the
yeah.
toilet and you're trying to get there and you might have a little leak on the way. So the bladder and the vagina are really rich in estrogen receptors. And when estrogen levels fall, as 80% of us, as we go through and get older without estrogen, will suffer from genitourinary syndrome of the menopause. And that means that the bladder symptoms are the ones we've just described, and the vaginal and vulval and clitoral changes are the ones that I'll just show here. So when we've got, this is a little diagram here of our of the vulval area. So we've got the vulva's got different parts to it. So it's got the mons pubis at the top, which is the fatty bit. Then we've got the outer lips called the labia majora, which have got hair on. And then we've got the inner lips, the labia minora, have got no hair. And then we've got sort of the vestibule in here, which enters into the vagina. And the clitoris, the clitoral hood is at the top. So you can see if you look, so when you look, you open your legs, you get a mirror. You can see the clitoral hood, but you can't see how big the clitoris is. It's quite a big organ, isn't it? And strangely, and quite shockingly, it was left out of anatomy books until really not that long ago, wasn't it? Because it was thought that it wasn't an important anatomical part of the body. And it is very important. So, but the wings that come down to the clitoris are things that you can't see, but they're underneath the vulval area. And then you have the entrance to the bladder, which is not in the vagina. I don't think it shows it here. It's just sort of in here, which is the urethra. So when you go through and lose estrogen, you can get changes in the tissues, and the tissues thin by about 2/3. So when we're young, us, sort of we're having periods and we've got plenty of estrogen around, if we have sex and there's a little cut, it can heal within about 4 hours, so really quite quick. But when we're older and things are drier and thinner, the cut takes longer to heal. So you can get a little bit of bleeding when you have sex. It can also be very sore and dry. Some people describe not being able to walk because it's so sore and dry, very itchy, like prickly, or you can get this wet discharge that comes out. Um, you acidity wise the pH acidity of our vagina is about 4.5. So that can change. We lose we have and that's full of lovely lactobacillus bacteria to keep it nice and healthy, and then it becomes less acidic. So we are prone to infections. So we've got to remember at that point that soap has a pH of Imperial leather soap. If you're as old as me, you might remember that. You don't put that in the vagina because that's got a pH of 11. So you imagine the change in acidity you're doing if you wash inside your vagina. So never put anything in there. It's a self-cleaning thing. So it shouldn't be douched or the things that I have seen people put in the vagina. What's the worst thing? TCP, Dettol, very liquid. Don't put those things in the vagina. Nothing goes in there. So vulval healthcare, we can get all of those things happen, and then we get shrinkage of the tissue, shrinkage of the clitoris, shrinkage of the vulva. So when I look at a vulva of a very much older lady, those flappy skin bits of the sort of the labia, the external and the majora and the minora have shrunk, and often there's just like shiny skin, isn't there? Really
Mm,
thin, very dry. So if you were to examine with a finger, it would be very hard. because it would be so uncomfortable for the poor lady. So we use obviously lubricants. So is there anything I've forgotten? Anything you'd add?
Um, I suppose the other thing, if we're talking about some of those symptoms because of those changes in the skin, like you've mentioned, a lot of women might find that they're getting really sort of lots of pain when they try and have sex.
Yeah.
So it just gets so uncomfortable. And, sometimes they might already be using some lubricants or moisturizers, but it can still just be very, very uncomfortable, which then has a big knock-on effect, doesn't it, on people's relationships and how they, libido, if we talk about that. And I think just going back as well to what you were saying before about sort of using soap, I think, I don't know about you, but in general practice there probably isn't a day go by that I'm not talking about things not to use. And even some of the products that are marketed
Yes.
use are not good, are they? So
I'm going to mention one. Can we mention one?
Femfresh.
Don't put it near the vagina. Nobody needs to have a vagina smelling of blossoms. So no, I saw somebody yesterday who was going, "Oh, don't worry, I'm fine. I'm using Femfresh." And I was going, "No, don't use that." So emulsifying ointment is one thing that our gynecologists recommend. You can use that as a wash, not inside, and you can use it as a barrier as well, or you can use non-hormonal, good quality moisturizer. So imagine you have a really dry face. You're not going to leave it. Oh, you're not going to go, okay, fine, I'm just never going to moisturize this face. You're going to just put loads of stuff on it. So don't choose a really cheap vaginal moisturizer, because that could be full of things that you don't want going in there. So I'm going to show one. This is one. There's another one called Sutil. Do you recommend any other brands? We don't get paid. We're not promoting. We're just advising and educating.
No, yeah,
So this is
they're the
VM
ones we
means
recommend.
vaginal moisturizer. So that's what that means. So you want to be moisturizing. So emulsifying ointment on the outside, not inside. If you've got discharge, don't wash it away. The vagina needs discharge. If it's dry, it's stuck together and really uncomfy. So it's supposed to have that discharge.
Yes.
So,
And yeah, so these brands are excellent, aren't they? Because they don't have those preservatives that the other
no.
ones have in.
And these are the lubes.
I also prescribe, on the recommendation of some of the gynecologists, something called Hydromol, or Epiderm, which people can buy from the chemists, can't they? They're quite thick. They're not as nice to use as these ones. So these are really nice products to
not
use.
posh and they don't
but
they're quite cheap and they're good.
They're cheap and they work. And the other thing that lots of people use, which can be quite messy but also works, is coconut oil. So you can just buy your tub of coconut oil, and probably keep a separate one for the bathroom, not for your cooking as well. But they're not as nice to use as the products obviously that are specifically made, but they're great, cheap, easy products to use that are a good alternative to the Femfresh and everything. And you can use them, like you say, whack on for cleaning, but also as a moisturizer as well.
Yes, and somebody's saying if they've got a discharge, did you still need to use moisture? So the vagina should make a discharge, so a normal, healthy, white discharge. If it's green and blood-stained and, not normal for you, then please get that checked out in case there's an infection. But you can still use a moisturizer with a vaginal if you have a vaginal discharge. And when you're having sex, making sure with condoms, if you're using condoms, you need to look to see that the lubricants are safe. But using an OB oil-based and WB water-based on you, and one on you, one on your partner, one on whatever you're using, any sort of sex toy you can use to make it comfy. These sort of mimic your own natural moisture. And libido, I don't know about you, Rachel, but so many people I see come in with low libido, and actually the cause for the low libido is pain on having sex. And when you just simply treat the cause for the pain, which is often this problem, then the libido naturally starts to come back, because you start to feel pleasure in your body rather than experiencing pain. And that's going to be the thing that puts the brakes on your brain. And you think, goodness, I don't want to have sex because actually it's really uncomfy. And then you start to avoid your husband or partner or whoever it is like the plague, because you don't want them to, consider that anything could cause you to become close. So actually I have seen people, want to leave their husbands because they've got this condition, and then they just don't want to have sex, and then that causes big problems with the relationship. So this is something we can definitely easily help you with. I've got some products. Shall I start to show what they are? We'll talk about vaginal estrogen.
Yeah, definitely. I think that'd be really
So
useful for people.
vaginal
Um,
estrogen is not HRT, is it? So it can be. Somebody at the beginning said, could they take it if they've had a history of endometrial cancer? So the answer is yes. Everyone can take this. The only people that need to consider to seek specialist advice are people who have a history of estrogen-dependent tumor like breast cancer, who are taking aromatase inhibitors. So other than that, somebody asked me, could they do it if they've had a blood clot or a pulmonary embolus or endometrial cancer? The answer is yes. So we are all going to develop these changes in the skin, in our bladder, and in our vulva, vagina, and our clitoris, and we can all use these. These are prescription things that can come. You can buy Gina over the counter. I think there's another one now called Valerie. Is there? Am I right in saying that? Well,
um,
it's definitely Gina.
I would need to double check. Yeah, definitely
But
Gina.
but you can
Yeah.
get it on, but you can get these from your GP on the prepay certificate. These are not weird, wonderful things that you can't, you have to pay for privately. You can get them from your GP. So, so the first thing you could consider is, do I want to use a cream? And if I'm using a cream, I could put it all around here and the urethra, because don't forget, we don't want the urethral bit opening up so bugs get in and you get an infection. So we want to give it all around the vulva, and then inside the vagina, and that will help the bladder as well. Weirdly, it all goes into the bladder area. So the creams are confusing now, aren't they? 0.1% and 0.01%. So essentially, you want, Dr. Sarah Ball described this, you either have a concentrated orange juice, little 0.5 mils of it, or you have 5 mils like a diluted squash. And it depends if you want to rub it everywhere as to which one to go for, but they are the same, because there are two estrogen receptors, aren't there? So there's estriol and estradiol. So the creams are estriol, 0.1% or 0.01%. And 0.01% is 5 mils, so there's loads of it around. And 0.1% is there's less of it. It's about half a mil, isn't it? So you need to look and make sure you're not allergic to peanuts, isn't it? So one of them contains arachis oil. So you've got that. So you can just draw it into an applicator, and you can just use your finger and rub it around to make sure that you're getting that lovely absorption everywhere. And then there's gel, estriol gel. This one's called, we're not paid by anyone. These are just the products there are. So this one's called Blissel, is a gel, and it's an estriol gel, and it can be used in the same way with an applicator.
Yeah, I quite like that. That one is meant to be quite moisturizing as well compared to some of them. So that's a advantage. Some people don't like the gel consistency compared to the cream, do they? But some people prefer the cream over the gel. So there's a degree of sort of personal preference in relation to that as well.
Absolutely. It's a bit like a face cream that some of us might like one and others might like another. And the next one this is a little pessary that you put inside with your finger, and you use that usually every day for 3 weeks. And so often these will have a loading dose. So the loading dose is an every day, every night for 2 or 3 weeks, and then you do it about twice a week. But if those symptoms, and it can cause a bit of irritation to start, can't it? So bear through that, and it takes about 2 to 4 months to work. But we can adjust the dose or the product or the type of products if it isn't working. So don't sort of think, oh, this hasn't worked, vaginal estrogen isn't working for me. There are other things we can look at. So this is like a really nice moisturizing one. You push it in with your finger, which is really good if you've got real dryness and actually you don't want to, and it's sore to put anything inside. So this might be really good. It leaves a little bit of gloopy discharge, but I think that's something that actually some people quite like, because it's quite moisturizing. That's estriol. And that again, so the creams and the gel and Invagis is estriol. And there is another one now, isn't there? There's a 500 microgram pessary. I have never prescribed, but it's a possibility. And then you've got these others. So these are estradiol little tablets. They're tiny, if you look at my finger and the size of the tablet. And so there are two types of applications. So the blue one is an everyday plastic blue plastic thing that goes inside. So you probably don't want to be choosing this one if you're environmentally friendly, because it just throws away every day. So it's called Vagifem, and the little tiny tablet sits in the top here, and then you pop it inside the vagina, and then you push the plunger and the little tablet pops out, and then that stays in there. So some people like that. This one is a reusable applicator. This is Vagirux. And again, you'll see the little tablet at the end, push it inside the vagina, pop it out, and then the tablet comes out. And that again is every night for 2 weeks, and then ongoing twice a week. And then the other thing which we can talk about, isn't it, is the plastic ring. So this is an E-string, and it's infused with estrogen, estradiol, and it stays in place in the vagina, doesn't fall out. You can have sex with it in, and it stays in place for 12 weeks. And then you can either replace it yourself, or I'll get to that in a minute, or you can get someone to replace it for you. And these are quite good if you've got someone who's got a ring pessary in place, or some sort of a pessary in place. They're quite good for that. Sorry, I don't know what that comment is. So if you're cancer with estrogen forward, is it definitely safe for the vaginal cuff?
I think she maybe means the vaginal, the estradiol potent. You know how we talked about using, it's the same person. I think the British Menopause Society brought out some guidance recently, didn't they, about HRT following gynecological cancers.
Yeah.
And the guidance from them is very clear that vaginal estrogen is very safe for this group of women following treatment. And the reason for that is because the amount of estrogen that is absorbed by the body when you're using vaginal estrogen is minimal, isn't it? We, you know, when they've done blood levels, there's no increase in levels of estrogen in the body when you're using, you know, particularly the estriol type preparations. And we've got studies that show that. So generally, you know, generally we say it's completely safe, even if you've had a estrogen fueled, or, you know, estrogen receptor positive cancer. So definitely discuss that with, you know, your clinician and your doctor, because, you know, if you've tried everything else, you know, the moisturizers and the lubricants, and it's not working, then actually it would make a lot of sense that, you know, discussing that treatment would be sort of usually the next step. So yes, that's the current evidence and the current guidance. Yes.
There's a really good document, isn't it? Just as you just said, so the gynecological cancers document that gives us everyone the same guidance, because there was a little bit of confusion about who could have what, but actually so that's a really good base to look at. And if you've had a history of breast cancer, even if you're taking tamoxifen, you try the non-hormonal ones first, and then if they don't work, you can try these estrogen products. And if you're on an aromatase inhibitor, then it's a discussion, isn't it? So between your menopause specialist and your oncologist, to work out whether the symptoms are, what to do about the symptoms, whether to keep you on the aromatase inhibitor, change treatment, or add something. Is it safe for you? So that would be a discussion. It's individualized to you. And yes, so it's really good to know there are other products that we could talk about, but they're not usually used in general practice. These are the ones that often are the ones to start with. And I think if you get your vulval care right, and you get and you're using a good quality moisturizer and good quality lubricants, and you're using regularly, remember, so these vaginal treatments are long-term use. They're not just to be used for a few weeks or a few months. They get the tissues back to health, and you should start them as early as you need to, so don't wait till everything has become really severe. 25% of women who use HRT will also need to use these as well. And 80% of us who don't use HRT will experience these symptoms. So we can start these in ladies, and often, I know we both will start them on ladies who are in their 60s, 50s, 60s, 70s, 80s. I mean, there's no one that's too old for this. Yeah, exactly. Anyone can have it. So, and they just benefit, and they really do. And I've seen people go from not being able to leave the house because they have such terrible urinary symptoms, lots of vaginal dryness, to booking a holiday, you know, with her friends, because she was so happy that she could actually control her bladder and felt really comfortable. So these are not difficult. They're not difficult to get. They're not complicated to use. Long-term treatments that you just keep on going until, you know, until the end.
Yeah,
So we don't want to be
absolutely.
stopping them. There's lots of brilliant information. There's information about it on the Women's Health Concern fact sheets. Have got some the information on vaginal dryness, on prolapse, and on urogenital symptoms. There's also some brilliant fact sheets on the Menopause Research and Education Fund. I've got some fact sheets. One is on genitourinary syndrome of the menopause, which is really helpful to look at. So anything else that we've forgotten to say? Oh, and you can
Um,
use these along with HRT in case that
yes,
wasn't clear.
yes. So
Yes, they
yes, I
can
think,
be
yeah,
added to your HRT.
often, yes, we do add them in where they're needed. I suppose the only other thing to say, I think, about particularly about the urinary symptoms, is that for some women, particularly with the stress incontinence symptoms, using vaginal estrogen alongside pelvic floor exercises is often really helpful. And there's an app called the Squeezy app which can help with that. And I also had a conversation with a specialist pelvic floor physio the
Yes,
other
you did a
week,
brilliant live, yeah.
and she was really useful with brilliant information around that. So definitely have a listen to that if you're wanting to have a listen. But yeah, the Squeezy app is great, isn't it, Carys?
And there's the POGP as well, isn't there? POGP website, which has got some really good information on urogenital symptoms, which is also quite helpful for people. So really making sure, I think pelvic floor physios are absolutely worth their weight in gold. But one thing I really realised is that lots of us think we know how to do our pelvic floor exercises, but maybe we're not doing them correctly. So today I examined a lovely lady, and she when you put a finger inside the vagina, you can see if someone can squeeze. And actually, often people aren't squeezing in
The right
where they
bit.
think they are.
Yeah.
Yeah, exactly. Everything else is squeezing, but the vagina isn't moving. So really, if you're worried, then asking your GP to say, look, I don't think I'm doing this right. You know, could I go and see someone, or can you check that I'm doing this correctly? Because it's not easy sometimes. And once you know where you're doing it correctly, you can then practice it, and then you can build up to doing it properly. But I find it not infrequently are people doing this, maybe not how they think they are. And the last thing I'd want to say is get your mirror and a torch and look at your vulva. Do your breast exam and your vulva exam every month so that you can see if there is a change, because we do see vulval cancers, we do see vaginal cancers, we also see lichen sclerosis, lichen planus, we see psoriasis, we see dermatitis, we see all these things around the vulva. The vulva is just a delicate area of skin, and often people don't want to look below the waist because they don't sort of, I don't know why we don't do that. Many of us don't do that, whereas we should, because the more comfortable we are at looking at our own body, the better. Then at least we can know if there is a problem or a lump or spot or itchy bit, because there's nothing more panicked, and naturally the word that you're going to want to sort it out, aren't you? And the thing that you're going to sort it out with is likely to be something you shouldn't be using, like those things I mentioned earlier. In desperation to try and help yourself, you're going to be putting something on there that possibly isn't the right thing.
Yes. And I suppose the other thing to say as well is that often I speak to lots of people say, oh, I've tried vaginal estrogen and it didn't work for me. But then we have a conversation around, how long they were using it for, what they were doing, how they were using it. And actually, there's definitely things that we can suggest and tweaks to how they're using it or how long they're using it for. There's other products, aren't there? And I think to highlight, if actually things aren't improving, definitely go back to your GP, make sure that you've had a good exam, particularly if things aren't improving, because there can be other things, can't there?
That is so important to say.
Definitely, following that up if things aren't helping, just in case we need to do something else or think about other possibilities as well. And just sorry, I know I can talk for ages about this, but one last thing is, I think somebody put a comment on, do you still need to use moisturizers if you're still having discharge? And I would say you can still have the atrophy symptoms, can't you, even if you're still having discharge, or even if you're still getting appropriately lubricated. I think a lot of people think, oh well, everything's working fine during sex, it can't be dryness, or they're not using moisturizers and things, but definitely the two are not mutually exclusive. So definitely using moisturizer if you're feeling that things are not 100% as they should be, and definitely thinking about vaginal estrogen if that's not sufficient. I think we
Oh,
spend
and
so much
oh,
money on our face, don't
I
we?
know,
Well,
I know.
you know, we
Oh,
spend so much money
exactly.
on
We should.
moisturizers for our face. So, you know, thinking about, you know, what we're doing for the vulva and the vagina. And somebody also asked, where can you buy the moisturizers? So you can get them in Boots,
Online.
but also on the Yes website. I know they used to send out samples, didn't they, to people?
Yes.
I don't want to say that they still do
I
that.
don't know. They've got little tubes, and you can, yeah, it's called Yes Organics, or Sutil will do it as well.
Mm.
And one last thing before we go. So this is general care of the vulva. It looks like it was written about 100 years ago. So it's one of those things you think, oh, it's really like typed with a typewriter. But it says, so avoid all contact with soap, shower gel, personal deodorants, and baby wipes. None of
Oh
those
yes,
wipes
white
around
baby
there.
wipes are another thing that we see,
Big,
aren't
big
they? Yeah.
problem. Emulsifying ointment should be used as a soap substitute and as a barrier. Well, that's a possibility, like Epiderm, like those other things we were talking about. Wear cotton underwear washed in liquid soap. Some people, so that what the consultant was saying was, you know, what gets your whites whiter? It's bleach, isn't it? So some people are so sensitive to bleach that actually even putting their underwear in the washing machine could be an irritant. Avoid contact with non-prescribed over-the-counter preparations which may make your skin worse. So that's things like cheap moisturizers and cheap lubricants. Don't put those anywhere near your vulva. Always wear loose-fitting underwear and try to avoid outer garments such as cycling shorts or tight leggings. So let the vulva breathe. And if you're using sanitary towels or incontinence pads, change to unbleached alternatives, because if you're putting something bleached and white next to your vulva, that could also be irritating. So avoiding using them if possible, but also there are some products which are unbleached, which might be
Yes.
something to consider. These are people, you know, this is the sort of thing that it might be worth knowing about. And you might inadvertently be doing something that's causing irritation without really knowing about it.
Yes, so period pants are another thing, aren't they? Which are
Oh,
excellent
yeah.
for lots of women, but because they've got often they have sort of silver in or things to
Oh,
absorb the blood,
okay.
can be quite irritating for some women.
Yes.
So just, I'm not saying that that's the case for everybody, but if you're
No.
struggling with lots of symptoms, just thinking about those sorts of
Those sorts
things.
of things, yeah. And bath bombs,
Oh,
anything
yeah.
that goes in the bath, bubble bath, don't use it. So they also affect. The most common reason I get for little girls who won't have this condition but who have vaginal soreness and discharge is the things they're putting in the bath. So the things that are lovely, you know, they have bubbles everywhere and they release all pink petals. Don't put those in the bath or use bubbles. So if you're, it's better to avoid those sorts of things.
Yeah.
I think
Good
that's it.
to think about before
Yes.
Christmas. Christmas presents,
Don't
no
get
no bath bombs.
yeah, unfragranced, very boring water, and that's all you need. You can have candles and things, but just don't put anything near the bath. I think we've done it, haven't we?
I think yes, yeah. I think we could talk. We could talk for hours about this, but yes,
Yeah,
I think we've covered the key points there. So yeah, thank you so much, Carys. Um, I will upload this to the YouTube channel over
thank
the
you.
next few
Amazing.
days,
Yeah,
and obviously I think you will save it to
yeah,
the grid, won't you?
I will.
And yes, thank you everyone who has come and watched live. Thank you to everyone who's listening to the replay, and do check out the resources that Carys mentions on the Women's Health Concern website about GSM, that you mentioned, that excellent leaflet.
Yeah, I'm just sorry. I'm listening to it, but I'm just thinking, can you put food coloring in for little children? I'm probably
Oh,
going to go with a no, but I don't know.
yeah, no one's ever asked me that before, so
No,
I, um,
I don't
I
know.
don't know. Unknown.
Yeah.
Sorry.
Yes, and sorry, I was just thinking about that. Yes, so just making sure you go and speak to your doctor with any concerns, but we will upload this, and I think that covers nearly everything, all the products you can get from your doctor.
Oh,
Okay,
perfect.
lovely to
Oh,
see
thanks,
you.
Carys. Have a lovely evening.
Thank
Take
you
care,
very much,
everyone.
everyone, for joining. Take care. Bye.
Bye.